Okay, I think we are live. Let's have a look. Okay, I think we're live on Facebook. Dr. Chah, how's it going?
Hi, Stephen. How are you? Thanks for having me.
It's nice to see you. So
Likewise.
anyone that's joined a health expert session with my colleagues, the osteopath and nutritionist, who talks about constipation. But this time we're going to talk about the other end of the digestive tract, and probably the most important part of the digestive tract. Would you agree?
Yes, it is. I think the whole system is interconnected. Every part has to play a very fine-tuned work, basically, to get the whole system to work smoothly. So I think it starts with the mouth.
Absolutely. So, I think we're still live. Let's have a look. So you're obviously very experienced as a dental practitioner, but do you see a lot of people with TMJ type problems?
Yes, Stephen, there are a lot of the patients that come to us, they can suffer from TMJ problems, or basically the jaw joint problem. And sometimes it can be that the source of the pain could be the TMJ problem, or the source of the pain could be somewhere else, referring to the jaw problem. So this is something that we do see on regular basis in our clinics as well.
Yeah, great. If you're at home and you've had TMJ problems before, you'll know how absolutely uncomfortable they are, because you use your mouth with pretty much everything you do, from laying down and sleeping, where you're putting pressure on the side of your jaw, to the obvious things like eating, talking, breathing, smiling. All of that can give you quite a lot of problems if you have a TMJ problem. So if you've got it at home, we really sympathise with you. We'd love to be able to help you, give you some advice. So if you stick around to the end, we're going to give you our top 3 tips on what to do if you've got TMJ problems. But firstly, the function of the TMJ is so important, isn't it, when you're considering anatomy? But what's the function of the TMJ and how does it work, Dr. Neysan?
So the function of the TMJ is the main function, I suppose, is to move the lower jaw. Obviously, I'm sure everyone knows we have the upper jaw, which holds our upper teeth, and we have the lower jaw, which is the movable part of our mouth, and that basically is supported by the TMJ. And the TMJ and the lower jaw are supported by different muscles around our face, which goes to the side of the head as well. And there are some muscles on the inside as well to support the jaw and provide the function. So the function of the TMJ is to basically hold the jaw in the correct position. And what's interesting about the jaw joint, or the TMJ, is that it's quite resilient, and the movement of the jaw is very unique, because when we open, the jaw opens in 2 different phases. One phase, actually, I'm going to use my models. I love my models. It's always easy to describe things. Everyone can see that. So that's my plastic skull. And obviously, when we draw in the first phase of the movement, the jaw kind of goes up and down in a rotational movement as such. And later on, when we open a little bit wider, the jaw basically comes out of the joint over a little bit of bone and opens further. So it kind of dislocates from the hinge, and starts coming out of the jaw socket and goes over the bone. And that way we are able to open a little bit further. So it is a very interesting, not many, I'm not aware of any other joints that can do that. Basically, they kind of dislocate as such and come out, and the mouth can open a little bit wider. So it's one of the most important, in my opinion, as a dentist, one of the most important
You're not biased at all, are you, Nathan?
Not at all, not at all. Yeah. But without the function of eating, humans can't survive. So it is quite a resilient joint. It does have the capacity to heal itself, and it does take a lot of load and a lot of burden. And that's why it has very unique features that allows it to withstand all of those forces. And when something goes wrong with the jaw joint, it does have the capacity to recover and heal itself up, given that it is given the correct environment for it to heal and recover.
Yeah, I think one of the most fascinating things from my geeky point of view about the TMJ is the shape of it, the function of it's really interesting. But I think the disc that's inside the TMJ, that's probably the most fascinating piece of anatomical architecture in the whole body, in terms of the way it attaches and how it displaces and the problems that you can get associated with it because it's so specialist, right?
Yes, absolutely. That disc that you're talking about, it's like a little piece of cartilage. It is a piece of cartilage, but it has very unique features. It's about the size of your thumb, that sits right above the jaw joint
Condyle.
and the condyle, and it separates the upper part of the jaw, which is the skull bone, and the condyle, which is the lower part of the jaw, and it's attached to the mandible.
Yeah, and the other interesting thing that I find is that there's a small sliver of muscular attachment onto it. So it's actually not just an inert structure. It's actually mechanically it's advantaged because of the muscle attachment from the pterygoid, which attaches onto the part of it. So as an osteopath, we sometimes do internal work up underneath the jaw, inside there with gloves on, with consent, everything else. But just going up inside there to release that lateral pterygoid, the superior part of the lateral pterygoid, which can become quite dysfunctional and cause people to have clicking or grinding in their jaw as well. So that's a common thing that we see, but it's a very difficult joint to treat, isn't it? As a dentist, do you get a lot of people coming in complaining of jaw pain?
There are a lot of people out there. There is a certain group of people, females are more prone to it, and there is a genetic factor to it as well. Some people are genetically more predisposed to getting joint problems. It's interesting, Stephen, that you said that the lateral pterygoid attaches to the disc itself. That's
not to the disc, onto the capsule.
Onto the it mostly attaches to the bone of the mandible, or the front part of the joint. It's the jury's out, but a lot of the studies have shown that the actual muscle attaches to the bone itself. Some fibers, yes, interlace and attach to the disc itself, but the is weak.
I'm glad I remembered something correctly. I thought you were going to stitch me right up then. How embarrassing would have that been?
Yeah, no, it is the lateral pterygoid is very, very important. The lateral pterygoid is a little small muscle on the inside of the jaw, and you're absolutely right. It is quite a tricky muscle to get to. So fair play to you for getting in there and releasing the pressure in that muscle. But it is a very important muscle. It's one of the weaker muscles, in my opinion, of the masticatory system, because one of its functions is to open the jaw. And if anyone can tell you that if you open your jaw for a prolonged period of time, that muscle does get fatigued and all of that. But to go back to the disc, the actual muscle itself can have effects on the disc and the joint and all of that. And the muscle itself, like any muscle, can go into spasm and cause a lot of issues. But the disc displacement itself, it's not directly related to the pull of the muscle. If my memory serves me correctly, but there are other things that happen that can displace the disc, and parafunction is one of them. By parafunction, I mean functions that are not very natural for the human jaw, like chewing gum for prolonged periods of time. That is one of the things that can have significant damaging effects on our jaw joints, and can cause pain and all of that. So a lot of patients with we'll just give one of the tips is chewing gum is not really recommended for a prolonged period of time. I know from a dental perspective, chewing gum stimulates the saliva in the mouth to neutralize the acid in the mouth after eating, for example. but prolonged gum chewing is something that I wouldn't really recommend, because it can make a joint problem worse.
It's very interesting. There are some conditions where you'd give people gum to chew, though, wouldn't you, in terms of building up the muscles of mastication? So if they had very weak masseter muscles or temporalis muscles in particular, you could give them gum to chew to help improve strength around it.
I personally don't, Stephen. One of the things that I particularly don't recommend is chewing gum, but I'm sure that function, it's like an exercise basically.
Yeah.
But again, I personally don't, so I wouldn't really comment on that, but it is something that has to be done carefully and structurally. Otherwise it can make the condition a little bit worse.
Yeah, so I think that the people that we tend to see that in mostly with very with hypermobilities, joints are very flexible. They don't have that proprioceptive functions. Actually, giving them that may be helpful in that particular situation. But obviously, you should see someone to give you very specific advice for you. Don't listen to what we're saying and try and repeat it without any assessment at all. So that's good.
All discussions here, Stephen, I'm sure it's mentioned before. It is a general discussion basically, and
yeah, sure.
Specific cases, it is better to basically have a face-to-face or a virtual face-to-face discussion with patients and give them the that is appropriate for them.
I think one thing that's particularly difficult with TMJ is that there tends to be quite a lot of history that goes along with it, and also a lot of anxiety, because it's such a, in terms of the hierarchy of where things sit, it's really at the top in terms of like importance for body function. But do you think that's why that there's a lot of psychology attached to having TMJ problems, and people worry about it a lot, and it's obviously very distressing for them?
It's one of the functions of basically the oral cavity is the function of speech and eating. So those are two very, very important human functions. Obviously, eating to sustain us and keeps us alive. And speaking is how we interact with people. So any dysfunction as such with the whole mouth, including the TMJ system, can have quite adverse effects on patients' social lives. For example, if you constantly have a pain on the side of the face, it is quite difficult to function as normal. So I think psychologically it does have a very, very important role to play. And people with any type of face problem, be it a toothache or a jaw joint issue or a headache, for example, can have quite significant effects on their lives in general. The head, as you know, Stephen, it is quite a sensitive part of our body. It is full of nerves, and those nerves are very, very sensitive, because the head is one of the main parts of our body, and in order to protect it, it is quite sensitive to give the appropriate feedback to the brain to keep it safe.
Yeah, no, it's very interesting. So one of the common things that people come in with is obviously pain, but there's lots of different types of pain that can be associated with like oral and facial pain, aren't there? So what common pains do you come across in dental practice?
Obviously, the most common pain or issue that we come across is dental pain, toothache, abscess, these kind of things. That a very common toothache pain. That's the most common thing that we do tend to see. But then when you go from there, you have the jaw joint pains. There are muscle pains in the face. There are headaches that can deposit in the facial area, and as such, there are other nerve issues and stuff like that, but they are less common. So the most common would be dental pain, and the second one would be jaw joint pain and jaw joint issues.
Yeah, so when people come to see an osteopath, they tend to have been to see a dentist already. So the dentist has quite thankfully got rid of the jaw pain, as in from the jaw and from the sinuses. Often that can be a dental related problem. as well as the kind of upper and lower mandibular and maxillary teeth. So they can refer a lot of pain up into the jaw. But I'd say that then the things that we see are probably not so common. But in terms of what we see, they're very common because we've seen the end of the line people, I guess. So it makes it skews it slightly. But the key things that we'd look for are referral from like trapezius muscles here. They can be a good source of referral up into the head and neck. Sinuses, obviously, they're a big cause. So the maxillary sinus here in particular can give you referral into the jaw joint. Trigeminal neuralgia, that's a very common cause that's often missed with people with that kind of facial pain in that kind of mandibular or maxillary region coming down there. That's a big thing to think about as well. Referral from the neck, that's another big thing, which I know we were going to talk about, which is some exercises to help people if they've got kind of neck pain or they've been given the advice of doing neck exercises. Then we'll go through some things that might be quite useful once you've had a proper diagnosis. But those would probably be the top things that would be other things for me that would refer into the jaw to give people problems. And obviously the internal muscles as well, so the pterygoids, in particular the lateral pterygoid tends to be the one that we work on mostly. Yeah. Yes, it's very interesting. Are there so also ear pain? So ear pain is another one that can give people referral into the jaw as well. So it's a good thing to rule out if you've got any dizziness or vertiginous symptoms where the room's spinning or you feel unbalanced. Then it's probably not just your jaw. It might not even be your jaw at all. It might be coming from your ear. So it's definitely something to rule out and make sure you've got under control as well. But there's some weird things that you come across that cause jaw pain. I've seen some weird things. Let's see if mine's weirder than yours.
Go on, you start.
So, Mike, go on. I've got a couple of things. So this keep going for a while, I think. But I think the weirdest thing has been like tumors growing inside the jaw. So really nasty stuff. So they're obviously things that you don't want to miss clinically. But the only way we picked that up was because the person hadn't been to see a dentist. So we couldn't find what was causing the problem. We referred them to a dentist, which they thankfully did an X-ray and found a small tumor growing inside the cheekbone effectively. So it was really rare tumor, but an osteoma, I think it was osteoid-osteoma, so it was completely benign. Wasn't going to kill them, but it was certainly interesting that it was there. So they had to go through some injections to see if that would get rid of it, and obviously have surgery to take it out, and it relieved the pain. So it's more the pressure of the tumor that was causing the problem. Go on, your turn.
Now, it's very interesting. Yes, jaw joint tumors are quite common. There are a lot of disease that can happen with the jaw joints. It's a joint at the end of the day, so it can be affected by the systemic issues like rheumatoid arthritis, osteoarthritis, and stuff like that. And over time, it can affect the bony part and the cartilage part of the jaw joint. One of the interesting cases that I've seen, and if you remember, I said the jaw joint is quite a resilient joint in the human body. It does tend to recover the function aspect. One of the interesting cases that I've come across in my career is a jaw joint that was completely resorbed, both sides.
Wow.
And
how old was the person?
they were in their 30s to 40s.
Wow. What happened with it?
Sorry?
What did they have something else that was going on, like some kind of arthritis or something that eroded the joint?
It was a general, basically, arthritic condition that was affecting the jaw joint as well. And it was a chance finding because the function was quite normal, but the teeth didn't sit right. It's just, we won't go into the details, but I knew from the beginning that there was something that was a little bit off, even though the jaw function and eating and all of that was completely normal and no pain. But when we took the x-rays, and that's where x-rays come very, very handy, and they are very, very important as part of the assessment of the jaw joints. The x-rays showed that there was a lot of resorption. The condyles are normally this shape. They were completely flat, so that part on the top was completely gone on both sides. And when that happens, it moves the jaw backwards and upwards. So it can affect the way the teeth come together as well. So when we are doing the general examinations, obviously we look at how the teeth come together, and that was very, very interesting, that the way the teeth were sitting wasn't your normal occlusion or the way the teeth come together. And that basically prompted me to take further x-rays and look at the jaw joints in a bit more detail. So that was one of the interesting cases that I've seen in my career.
So we've got someone on the line called Shane Higgins, who's an absolute legend. So he called it idiopathic condylar resorption. So he's called it.
That's
exactly it. Very technical, Shane. Really good. He said to go and see an orthodontist.
Absolutely. I
think is he an orthodontist? Let's have a look. Shane, are you an orthodontist, my friend? Let's see. I think he might be. That's fantastic.
Yeah, and yeah, I've known one or two Shane Higginses in the past, and I think I know who Shane.
You know who he is?
Yeah.
He's got some stalkers, my friend, Neysan. You must be famous.
Absolutely.
What's going on? Brilliant. Excellent.
Interestingly, that particular case wasn't idiopathic condylar resorption, but it was very, very, very close.
Right. So Shane, unfortunately,
was on the list of differential diagnosis.
Close, but no biscuit tonight, my friend. So it sounds like Shane's an orthodontist, and it sounds like you know him. So I'm sure he'll take that in jest as well. So thanks for joining us, Shane.
Hi, Shane.
Excellent. How do you know each other?
We go back to our dental school, I think.
Really?
Yes.
Can we get him online? It'd be great to talk to an orthodontist about some of the malocclusion.
Absolutely.
Yeah, that'd be great if he's around. That'd be really interesting. So, Shane, we want you to come online. It'd be great. Let me send him a link. Do you think he'll come online now? Shane, if you're up for coming online, just hit the just let us know. Just put a comment in the box below or something. But yeah, so would you say there's any other cause of jaw pain that people should be like mindful of in terms of like common things, not really rare things, but common things? So you mentioned chewing gum. We talked about rheumatoid arthritis. That's a very common thing that we see a lot of, that people don't understand that they've got jaw pain. And he said maybe some other time. He's chickened out, but he's in his pajamas, I guess.
Yeah, maybe.
He says he's in between things. We'll get him online.
Yes.
But yeah, thanks, Jen. Sorry, Neysan.
Yeah, one of the most common things that can give rise to jaw pain is muscle referral. Obviously, there is muscles. There's two big muscles here, two big muscles there, and some on the inside. And we've already talked about the smaller lateral pterygoid. So muscle pains can give referred pain to the teeth and to the TMJ, and sometimes even to the ear. So that's one of the things that we have to look at in the examination to see if the muscles are playing a part. And as you mentioned, muscles of the neck area, the trapezius, the sternocleidomastoid there can give rise to jaw pain as well. So this is one of the common things that we do come across. And that's where the chewing gum comes in as well. Obviously, the chewing gum can have effects on the jaw itself. But if we are constantly using those muscles of the face for chewing something for prolonged period of time, like any muscle, it can go, fatigue, and it can start to basically go into spasms and stuff like that, and develop painful spots in the muscle. So that's one of the common things that we do come across as well. Obviously, clenching. This is something that actually might be very relevant to this situation that we are in. Clenching and grinding our teeth can have effects on the muscles and the joints and stuff like that. So one of the misconceptions that I do see in my clinic is when you ask someone to basically put their jaw in the relaxed position, the first thing they do is clench their teeth and chomp the teeth together. That's actually not the relaxed jaw position. The relaxed jaw position is the teeth slightly apart and the lips barely touching. So teeth shouldn't come together during the day for prolonged periods of time, except for certain speaking sounds and certain chewing motions, and when we swallow our food. So when teeth are together, or if anyone watching finds that their teeth is together for a lot of the time during the day, there is a possibility that we might be clenching
Yeah,
teeth
it's very
over
interesting.
time. That can give rise to problems.
Neysan, we've got two questions. So Saha has just asked us if we find that, well, if you and I, but probably more so you, if we find that dental problems are more common in males or females. It's a very interesting question.
It is a very interesting question, but it is very general. So it's a difficult one to answer. So it depends on the type of dental problem. Jaw joint issues, for example, in my experience, it's more common in female patients, but other problems could be more predominantly male problems. So it depends on the issue, but specifically jaw joint issues, I see a lot of female patients with that, and the age group is in their females in their teens to basically late 20s. I do see a lot of female patients in that age group that have a lot of jaw joint issues.
Yeah. So I'd probably say typically in my clinic, it's been mainly young females. So females around the age of, it may be just where we are. So it's not, I don't think that's completely representative. And the thing is that asking us that question, I think you'd need to look at a much wider population to be able to get a true reflection. But in my clinic, it tends to be young, athletic women in a certain area. So London and Hertfordshire area tend to be lots of stress going on, lots of family pressure going on, grind their teeth. I can think of at least like 60, 70 cases now of individual people that have come in with that fit that stereotype. So that's probably not representative across the whole population, but certainly in and amongst the clinics that I personally work in, that's probably where I see most of the worrying symptoms. And if so, the way that we deal with those cases is multifactorial, because it's not just about, it's about taking a really good history. So getting to the root of what's causing the problem, identifying some of the physical and the psychological stresses that are there, whether it's just worry or anxiety or exam time that tends to bring out a lot of these cases as well. So people doing A-levels, GCSEs, that tends to be a very stressful situation. And like dealing with those and giving them tools to be able to deal with those, or the right person to go and speak to if I'm not the right person to help them with. But certainly speaking to your GP at first port of call would be a really good way of dealing with that, and just getting much clearer on the causes of what's causing that. So Linda's asked the question, Neysan. So she says, hi, I'm having a lot of problems with the right side of her face. She's had an ear infection. The doctor said that it's coming from her tooth, but she's had some x-rays done, and they've come back clear. She had a sinus operation, but she's always had problems with her ear. Linda, just to be clear, was the ear problems, did they occur after the sinus problem? So that would be a good question to ask. But what's your thoughts on that initially, Neysan?
Absolutely. I think you hit the nail on the head, Stephen. Jaw problems, ear problems are very, very closely interconnected, and they are normally multifactorial. Normally, when there is a very obvious reason, for example, a tooth with a big abscess on it, that is quite obvious, and that would be the first thing that we would treat if the patient presents with the tooth problem and maybe referred ear or jaw problem. But at the same time, you have to look at everything. So that's where the examination, a very thorough examination, is really indispensable. So you have to look at everything. Even when the cause is obvious, obviously we look at everything, all the structures around the area. So it is very, very interesting. A lot of tooth problems can basically deposit in the ear. the ear, the way I would describe it is it's like a little airport where there is a lot of nerves entering. I think off the top of my head, there is 6 nerves that enter the ear. So any pain that is associated with one of those ears can be felt in the ear as well. And the TMJ and the ear are very, very close to each other. So any condition, like even a simple inflammation or discomfort in the TMJ can be felt in the ear, but at the same time, it could be vice versa. So ear infections. So it's a process of elimination. When patients come to us, obviously we look at everything and the obvious causes we start treating, and you have to eliminate other causes as well. So for example, if a patient presents with an ear problem and we know it could be related to a tooth or the TMJ, we do start basically the treatment protocols appropriate for that case. But at the same time, we do refer patients to ENT surgeons, their GP, and get them to look at the ear, for example, to eliminate any pathology or infections and all of that. And the same goes with the sinuses, by the way. So it is quite important. A lot of and interestingly enough, Stephen, on the topic of ear and face pain and stuff like that, a lot of headaches can be the cause of tooth issues, jaw issues, and sinus issues, ear issues. So this is something that has to be looked at as well as the overall picture.
Okay, it's interesting. Linda said that she's always had these ear problems. So I was just trying to get clarification over what type of ear problems they were so that we can be very clear on that.
Yeah, exactly. Obviously, we're not in the process of giving a final diagnosis.
No, just be interesting, because then we can give them very clear directions on what to do next. I think that's the useful thing here. But so Linda's actually mentioned she's one of your clients.
Okay. Hi, Linda.
So you might be able to give her some final diagnosis.
Obviously, not live on Facebook. Steve.
Not live. It's probably not a good idea to tell her to do stuff live, I don't think.
That's exactly it.
Certainly, she might want to contact you and talk to you face to face about that. Maybe come in and have a chat, see what's going on. But yeah, I'd be interested to see if Linda's happy to share with us. Obviously, I won't ask you to, but if Linda's happy to share with us what type of ear problems she had, that would be very interesting to see where the problem's coming from. But yeah, ear problems are quite an interesting discussion. It's maybe something for another time, but we see quite a lot of people with ear problems in the clinic that range from like tinnitus or kind of strange noises inside their ears or ringing inside their ears to more full-blown like pain or like liquids coming out of their ears and things as well, and waxy ears. They're very common symptoms. But yeah, there's a whole range of ear problems there that we need to try and be a bit more specific about, I guess. But it's very interesting. So we're going to talk about some of the common exercises that people are given for jaw pain. So what would you say, what are the most common exercises that you see people being given with jaw pain?
One of the common exercises that I tend to ask my patients to do is to keep the teeth apart, Stephen. So clenching our teeth, going back to the stress and all of that, posture is very, very important as well. A lot of people nowadays are working from home, so they might be hunched over in front of their computer and all of that. That obviously affects the neck and the shoulders and all of that, but at the same time, it can affect the jaw, because when we hunch over, the jaw tends to kind of clench together a little bit more.
Yeah.
It might be putting a little bit more pressure on our teeth and the muscles and the TMJ. So one of the tips that I can give is to try and be mindful of where the position of your lower jaw is. Are your teeth together?
This is a conspiracy. Everyone's before the guys are telling me about mindful eating. Now you're talking to me about, I think the universe is trying to tell me something. What is it about mindfulness that you need to do about your teeth? Why is everyone using that word now? Isn't that what you should do all the time? Just be conscious about what you're doing with your body.
Absolutely. This is this being mindful of basically our eating habits, our posture, our general habits in general. It's very, very important generally, but especially given those circumstances, we have to be a bit more mindful. And I really like that mindful eating advice, because we, as humans, when we are idle or bored, we tend to eat, and a lot of us just kind of snack and graze throughout the day. And obviously, going back to the discussion last week, it is very important that we are mindful of what we eat, and we are not eating just for the sake of eating, but there's actually a purpose to our eating and what we are eating. So it is quite important. It has nothing to do with the jaws, but at the same time, it is very important for our general oral health. And yes, it does come down to the jaws as well, actually. If we are eating a lot of foods that might not be appropriate, a lot of crunchy foods, very, very crunchy foods and stuff like that, we have to be a bit more mindful of that, especially if we have a jaw issue.
Yeah, yeah, excellent. So are there any exercise I would give people for their jaw? I think generally people with very low jaw tone, so people with, like we mentioned about the hypermobility, we tend to give them isometric exercises to help improve the jaw tone, so masseter in particular and temporalis. But where those muscles commonly affected, in probably the wider number of people come into the clinic, is through stress and anxiety. So obviously dealing with the stress and anxiety is important, but making people very aware of the fact that that could be a reason for them having these problems, and kind of who to go to deal with those kind of issues with, or talking about some of the issues. I think that's very important, and being mindful, like you mentioned. But I think giving people exercises to help reset the jaw in terms of the, not so much the alignment, but just the muscle balance. So I think that you get people that chew on one side of their mouth a lot. Maybe, I know I used to do this. So I had a problem with my tooth on the left-hand side here. So I developed this habit of chewing on the right-hand side. And now if I get a headache or a problem, it's on this side. So I did exercises to help release the jaw on the right side, and Linda was just telling us about the fluid that's coming out of the ear. It doesn't sound very nice, but I've told her to get in contact with you because it's probably a bit too much to share with people. But I'm not sure if she wants to delete that last comment she put on there, but it's quite incriminating if she doesn't. But Linda, probably best to go and speak to Neysan and the guys at the Roscam dental practice and see if we can get it sorted out for you. It's good that the fluid's gone, but maybe good to have a chat with them and see what they can do. But yeah, just coming back to that. So just to reset the jaw. So if people have got tight muscles on the right-hand side, the jaw, I think the jaw's interesting because the jaw opens and closes like this, but as you mentioned before, it kind of slides forwards at the same time. So I think giving people, looking at where the dysfunction is, so looking at which part of that movement is dysfunctional, working out which muscles therefore are dysfunctional, and then giving people very specific exercises to deal with the malalignment there, or misfiring of the muscles. So I think that's super important. Linda's going to come in and see you.
But we'd be happy to have a chat privately.
Yeah, I think that's probably more sensible than all over Facebook. But yeah, I think just looking at the alignment there. So we know that the masseter and the temporalis they're powerful muscles to close the jaw, aren't they? And then you've got the medial and lateral pterygoid, which are important to help the disc remove itself from the gap, and also the condyle of the condyle of the femur. No, condyle of the mandible, even not the femur. The femur's down here. This is the mandible. But the condyle of the I keep saying femur. Why does I keep saying femur? Condyle of the mandible move forwards and be able to articulate through there. So it's super important to get a really good assessment of the jaw to work out where the problems are happening. And if it's beyond physio or osteopath exercises, then really you should go and see someone like what was his name? Is it Sean? Shane, an orthodontist, to really get some probably the first line, I guess, is probably bite guards. And then probably like braces or more invasive things to help correct the jaw, because it can be a very bad long term, can't it, if the jaw's not aligned properly?
Absolutely. I think, Stephen, it goes back to basically you have to look at the whole jaw and the face as a general part of the body, and you have to eliminate and see what is going on. For example, if you said if stress is the root of the problem, without you can fix everything around it, but if that particular aspect that's aggravating the situation isn't addressed, it might not sort out the problem fully. So it's always important to see what could be causing the jaw issues, the generally tooth issues, ear issues, or anything like that, and addressing that cause specifically, and obviously addressing. There are different treatments like bite guards come into it, splints, sometimes jaw surgeries and stuff like that. So they all have a time and a place in our general health. And it is important to see the specific condition and see what could be causing all the issues that that specific patient has, and address them one at a time.
So I think one of the more we deal with quite a large number of sporting population as well. So I saw a few people come online earlier on that I won't say who they are, but have had jaw problems in relation to like impact in the side of their face from martial arts. So martial arts and boxing tend to be quite significant causes of jaw problems, I think, in the population of people that we deal with. But do you see a lot of people with like lockjaw? Because I think that's another common thing that occurs with people. And how would you go about relieving that for someone? Because there's a special manipulation, isn't there, to help relocate the jaw if it does become locked?
Yes, lockjaw, again, generally speaking, there is two types of lockjaw. You can be locked closed, where you can't open the mouth fully, or you can be locked open. So basically you can't close the mouth fully. So, and different things cause the two different conditions, and different causes cause each specific condition. So it could be a muscle issue, it could be a disc issue, it could be a dislocation of the joint. So it depends on what is the cause of the lockjaw and addressing that. Yes, there are specific manipulations, for example, to relieve a lockjaw, a jaw that has been locked open, and getting the condyle or and the mandible in the correct position so that the patient can close comfortably. On the other hand, for example, if the lockjaw is caused by a muscle spasm, so stretching exercises and all of that would come into it. And if it's a jaw issue, obviously the treatments that are appropriate for the TMJ come into effect.
Yeah, no, very interesting. Very interesting. So, Neysan, it's been really fantastic talking to you yet again. And hopefully we can tempt you back next week again to spread some love about dental and jaw-related problems. But we will put a post up on Facebook just to let people know a little bit more about what we're going to be talking about, probably 24 hours before, so people don't forget and you're left as a cliffhanger and excited for the next episode of our health expert session. But Neysan, it's been really great talking to you. Just before you go, could you tell us your 3 tips for people who are struggling with jaw pain and need some advice? What would they do about it?
Now, let's make it a little bit more general, Stephen. The top 3 tips that I would give to patients who don't specifically have pain is make sure that your posture is correct when you're sitting at your workstation, for example. Keep the teeth apart slightly so that they are not touching all day. That's one. A lot of people might have the habit of basically kind of biting on top of pens and stuff like that. That's a habit that can aggravate jaws. And if you have a jaw problem specifically, it can aggravate that. And chewing gum. That would be my final tip, to basically not chew gum regularly and all of that. So these are the top 3 tips. Keep the teeth apart during the day. It protects your teeth and the TMJ. and don't chew gum too regularly for prolonged periods of time, and don't be biting on top of pens, and these kind of things can aggravate everything around them.
Brilliant, brilliant. I think you raised a very good point that the advice that you hear on the health experts is not to give people specific advice, clearly, because we've never met any of you, or sometimes we've never met you. Some of them might be patients that are logging in, but if we haven't met you and we haven't assessed you, we can't give you advice that's going to be specific for you. So it's impossible to get specific advice. But if you'd like to contact Neysan, how can people get in contact with you, Neysan?
I think if you comment below on this post, or you can find us on Facebook, and if you're existing patients of ours, you know how to get in touch with us. Just call the practice and there will be instructions on how to get in touch with us, and we'd be happy.
Yeah. What's the telephone number of the practice if people do want to call you?
So it's 091763885.
Brilliant, brilliant. Rolls off the tongue.
Bear in mind that the practice is on limited function given the COVID-19 situation, but there are instructions on how to get in touch with us, and we will try our best.
Good, good. And you are still open to seeing emergency cases that come in, aren't you?
Yeah, we are here for our patients. So we are here to support people who need our advice and all of that. So if anyone wants just a friendly voice on the other side of the phone to give them some advice and all of that, we will do our best to help you with whatever we can.
Fantastic. It's really good. Really good. Neysan, it's been a pleasure talking to you. Thank you so much for your time. And we will pop your details in the box below so people can get hold of you as well, because that's going to be super important. And if you do have any dental problems or you like more specific advice, then certainly leave your details in the box below and be able to get in touch with you. Talk to you a little bit more about what's going on, arrange to meet you, and then be able to assess you and then give you some very specific advice to be able to help you move forwards with your health-related problems. But for now, it's bye-bye from me.
And bye from me.
And bye-bye from the Dude Islands. Take care. Thanks a lot, guys. Take care. Bye-bye.